Hello, I'm Dr. Neal Barnard. I'm on the adjunct faculty at the George Washington University School of Medicine, but I'm also the president of the Physicians Committee for Responsible Medicine. We're based in Washington, D.C. And a big salute to Dr. John McDougall, who I met 3 decades ago, I think it was, right here in Washington, D.C. And I got to say, John, you have taught me so much about nutrition, about health, how those things work together, and also how to convey a message that's honest and that's free of commercial influences and all that kind of stuff. And I have to say, you've been a real role model. So thank you for that. And I'm looking forward to many years of continued working together. Here in Washington, we've got some problems that some people don't have elsewhere, which is we have Congress. And Congress is good in many ways, but it's not so hot about advocating for healthier diets. So at the Physicians Committee, one of the things that we do is to use the clout of doctors to try to get changes through Congress. So if kids are eating not such healthful meals in schools, doctors are the people who can say, we're going to see diabetes and weight problems and heart disease in these children. We have to feed them in a more healthful way. But that doesn't start by lobbying on Capitol Hill. It starts with having doctors who, for want of a better phrase, who know what they're talking about. So that means we've got to get information into the hands of doctors and into the heads of doctors. And Dr. McDougall has been a leader in this area, and we're doing our part too. There are a couple of bills in Congress that would encourage a healthier curricula in medical school, if I can put it that way, so that medical students learn about good nutrition and that doctors who are in practice devote at least some of their continuing medical education to nutrition as well. But it doesn't start with lobbying, it doesn't start with education either. There's a layer under that we've got to make sure we're covered with. And we've been giving a lot of attention at the Physicians Committee to doing research studies. What I mean is, if I think that a certain dietary pattern is better or a dietary pattern is worse, you got to prove it. You got to put it to the test. And so that's what we've been doing. We've brought in people who have weight problems, diabetes, cholesterol issues, and probably the best known of our studies was a large NIH-funded trial where we tested a plant-based diet for type 2 diabetes. Now, this might have sounded a little bit radical to the reviewers at NIH who ultimately decided to fund the study, but the evidence had led to this point. We knew already that people following plant-based diets are thinner. We know they have lower cholesterol, less risk of developing diabetes. Would this kind of diet help when you've already got diabetes? We tested it against a more conventional diet, and the plant-based diet won hands down. Better blood sugar control, better control of weight, better control of blood pressure, better control of cholesterol, all those things. So we take that information, we give it to the doctors who go to Capitol Hill, who go to the media and say, we've got to get this message out to people. And we've got to really fight against the forces that are working against us. Every day when I get out of bed in the morning, I have to tell you, the thing that gets me into the office and keeps us going is the fact that we have the ability and the strategies that are going to make changes in this world. What do I mean by that? I mean that we now know how to do research studies that will make people change their diets. We know how to put that to work for businesses, and then we see the results. So we'll see a patient who came in a little unsure. They were kind of sticking their toe in that swimming pool, wondering if the water was too cold. They jumped in and the water was just fine. So they started a plant-based diet, and you know what? It's pretty good, and their diabetes improved. Maybe it went away. And when you see that, and you know that you can multiply that by 100 million, you've got that power. And I have to say, the medical profession is doing an important bit of work. But I've often felt that if I were just treating one patient at a time, it would take a long time to get through everybody. So that's why we want to think bigger. And in the same way as the McDougall program reaches a huge number of people through its advanced study weekends, through its website, through the tremendous programs that it has, we're doing our part too by trying to reach people in the press, maybe on Capitol Hill, and certainly in the medical profession, because we know that what we're advocating is the most powerful prescription of all. What I find especially exciting is that maybe 20 or 30 years ago, we thought food affected your waistline. Well, then we started to realize it affects your coronary arteries, and the right diet can open them up. And it affects your cancer risk. The right diet can help prevent cancer. reduce the likelihood that you'll have it, reduce the likelihood that you would ever die of it if you've got it. And then we're starting to discover it's not just diabetes and hypertension, but even things like Alzheimer's disease, behavioral issues. All of these things are affected by food. So the environment I now find extremely exciting, that we can take foods, healthy food choices, put them to work and solve some problems that years ago we never really realized that we had the key to. We've got it now.